In May, 550 University of Mbarara students will report to more than 50 health units in southwestern Uganda for their rural placements. Students work on multidisciplinary teams of medicine, nursing, pharmacy, and laboratory science, gaining not only an appreciation of the importance of working on such teams, but the skills to do it well. Organization of these rural placements is provided by the small team in the Community Education Unit on the medical campus. The placement begins with an orientation week featuring training in interactive skills, leadership, and primary health care. Senior faculty are active in the program as teachers and supervisors. Their support provides a solid foundation for the program. Graduates of the program, delighted to practice their newly gained skills in participatory training, vie for the opportunity to assist as junior facilitators the following year. The transport of 550 students, their mattresses, bedding, cooking supplies, to and fro rural sites throughout southwestern Uganda is a massive undertaking. At the rural centers, students assist in the health clinic doing clinical works, such as dispensing drugs at the window, seeing and treating patients. Half of their time is spent in the community. This evocative photo was the winner in the student photos contest. As well, families are visited, and meetings are held, both in rural and in semi-urban areas. Community service is provided through presentations at local schools, as well as practical interventions such as tippy taps, which are built and demonstrated. Students learn firsthand that rural life includes hard realities such as back-breaking work and limited access to the basic resources such as water, electricity, power, and cell phone coverage. Seeing how people cope with such constraints, our students come to appreciate the resilience of rural people. It even inspires students to take up new roles, with men taking their part in cooking. Not all our students are initially delighted to find themselves in rural areas without power, light, and often water. But almost all of them regard it as worthwhile, and for many, it is life-changing. As one student commented, "When I arrived, I thought I had arrived in a black hole, but soon I came to realize that what people had to deal with and how they coped, and I wanted to return in the future to assist them." Our students engage the community throughout their stay. One student group found pesticide poisoning high among cattle keepers. They learned the cattle keepers were unable to read the English warnings on the pesticide they used weekly to spray their cattle. So the students provided education and demonstrations of locally made protective clothing. The rural program has continued to evolve. With family medicine colleagues, we developed interactive primary health care modules. Here, a student teaches the community readiness steps to his colleagues. Some students have the opportunity to use these new skills in the communities. Here, a medical student demonstrates education in the community to teachers and community-based health workers using the food wheel. Where malnutrition is a problem and carbohydrates provide most of the calories, the food wheel emphasizes the importance of protective foods such as vitamins and minerals and bodybuilding foods and how to obtain them locally. A student here is being coached in storytelling using a flannel board to tell the story of African stone soup, emphasizing micronutrients such as iron, vitamin A, and iodine. 4 years ago, in response to an influx of international students, a cross-cultural workshop was developed. Each year since, we have held a cross-cultural workshop and now have a number of faculties trained in facilitating such workshops. 2 years ago, in recognition of the important role played by our partners, the health workers at the rural sites, a group of them were gathered together to assist us in co-creating ways to improve student learning at the sites. Involvement as site preceptors in the program has inspired a number of health workers to pursue further training. Most importantly, Mbarara University is increasingly being recognized for producing graduates skilled in working in rural communities. Many former students now staff sites in southwestern Uganda that didn't have staff before. Graduates from Mbarara have gone on to serve in rural and remote areas such as Yumbe on the Sudan border or Karamoja in the northeastern part of Uganda. Mbarara physicians who worked with the WHO on the Ebola outbreak in West Africa have identified the rural program as providing them with a solid preparation. A few student groups have presented posters and oral presentations on their projects at scientific symposia. We continue to encourage and support these efforts. Each year, a few student groups have been submitting reports from their projects at the scientific symposia in Mbarara. One of the most rewarding aspects of the program is the appreciation of rural communities. The Batwa, or Pygmies, of the impenetrable forest share here with students the woven basket they have made for transporting injured patients across high mountain passes. A number of our graduates have gone on to develop their own community projects. These include an adolescent program in peer group counseling, a women's group fortifying millet with dried fish, a school gardening project, and a malaria prevention program using school teachers.